Welcome to the chat room, live on CGTN. I'm Li Jingjing. Recently, China has announced a new set of measures to further optimize its epidemic control and preventions, ranging from proposing home quarantines for mild and asymptomatic cases to reduce nucleic acid tests to make it easier for people to travel and enter public venues. So this is a major change because probably many of you have already known that China took a much stricter and a very effective way in dealing with the pandemic since it broke out in 2020. It was very effective because China still has the world's lowest death toll to COVID-19, which stood at around 5,200. And even though many parts of the world abandoned the strict measures in dealing with COVID-19 a while ago, China continued its strict measures to deal with the different variants. But starting from this month, things will be different because now we are adopting new measures. So why China is adopting new measures now? How will this impact people in and outside of China? In today's chat room, we invited guests, including frontline doctors and journalists, to discuss the reasons behind this change and also to review the China's war against COVID-19 in the past 3 years. So without further ado, let's meet our guests today. My first guest is Dr. Wen Li. He is Deputy Chief Physician of the Emergency Intensive Care Unit, Beijing Hospital, the National Center for Gerontology. So Dr. Wen, welcome.
Hello, everyone. Really nice to be here with all of you and share my knowledge and some experience with my long-term duration of dealing with COVID-19 related diseases.
Really looking forward to hear your analysis. And my next guest is a reporter with CGTN, my colleague, Zhao Yunfei. He was the first reporter from CGTN who went to Wuhan when the COVID-19 broke out in the beginning of 2020. And he did many amazing work reporting this COVID-19 situation in Wuhan. So we will welcome Yunfei. So I'm like, even though I know you work very well, but I'm still want to hear more about it. There's so many stories that you did. Really, I want more people to hear.
I mean, great to see you again, Jingjing. I mean, it's a great opportunity because I think this is the first time we ever sit down and chat each other, and especially this is the whatever thing happened in 3 years ago. And you were also there in Wuhan. I was there in Wuhan, so there's so much to talk about, especially what really happened in the past 3 years.
Yeah, pretty long time already, 3 years.
Yeah. Yeah.
And last but not least, we have, well, you can say she's my colleague too. She's a reporter, CMG's reporter based in the Middle East, Yang Yuan. So Yang Yuan, welcome.
Hello, everyone. I'm reporter of CMG based in Dubai. And I hope today's program, I will share my experience and my story with you about how the Middle East counter about the COVID-19.
Okay, welcome. And we just had the China Arab State Summit. So it's important to hear the collaborations between China and the Arab worlds too. So glad you're here. So, okay, let's continue our discussion because I think many people inside of China, outside of China are really curious about these new measures because the recent change was announced on December the 7th, which is we call the 10 cloth, there's 10 new measures. But actually on November 11th, China announced this 20 cloth, 20 different measures. So within a short period of time, we optimized these measures pretty soon. And actually, Yunfei, it's not just in the recent 1 month. We've been optimizing COVID-19 prevention control measures over the course of 3 years, but probably the recent ones are the ones that people really surprised. So can you tell our viewers more about the recent change?
I think recently, not only people surprised, they're really celebrating what was really happening. They're celebrating the change of the policy. Absolutely, this is kind of the changes that depends on the current situation, especially the changing mutation of the virus. And me personally, I can share what I really experienced throughout this year. You mentioned about there are many different versions of the policy prevention and control measures. There are 9 in total, and currently China is using the 9th method. But in addition to that, there are a new 20 rules. There are new 10 rules in addition. This all depends on based on the 9 different versions of the prevention and control plans. I'd experienced actually 2 different versions throughout this year. We experienced the 8th version and the 9th version. They carried out the 9th version in June. And before that, I was outside of China for two times this year. In the first half of this year, I was in Ukraine covering the Russian-Ukraine crisis. So when I came, I stayed in Ukraine. Think about that. That's a war-torn nation. I mean, that's a place that really affected by the conflicts. So they're bothered by huge pandemic as well. So when I traveled back from Ukraine, I'd experienced the 8th edition of the quarantine measures traveling inbound to China. That was 14 days of quarantine, plus 7 days of quarantine at home. And I was in APEC in Thailand last month, and I experienced the 9th version. They shortened the period of time to 8 days, more precisely 7 plus 3 days. Excuse me, 5 plus 3 days. So it's more 8 days in total. Not only the length of the day, but also you can feel that there are many perspectives. They're losing the the checking of the virus. For example, in the first half of this year, you need 2 COVID tests to board the plane to China, and the second half of this year, you only need 1. So there are many details being exchanged.
Yeah, indeed. You mentioned the shortened period of time being quarantined if you came from outside of China, but actually in many aspects, this 10 rules, 20 rules, being very specific on how whether communities should be restricted if there are cases. And before it would be probably a longer time, but now there's clear rule to require you cannot just put random restrictions on any buildings or communities. If this building has to be restricted for a while because of many cases, then you have to be very specific and timely on when this region will be, people can come out. So there are very specific rules, and also to further optimize the healthcare system, the medical system for the elderlies, especially elderly people with underlying issues, how to make it easier for them to go to hospitals. So this new rules, even though it sounds just 10, but actually covers many aspects. So Dr. Wen, I would like to hear your opinion on this further optimized rules. So to many people, this is like, I think I already heard this theory, people saying this means we are opening up. This means we are totally abandoning this COVID prevention controls. Do you agree with this thought?
No, I don't agree with them. Personally, I think some might take these measures as abandon, giving up, or relaxation. But it needs to revise first. Such understanding of the current epidemic prevention policy is too simple. Dualism is certainly not enough to understand and address the fight against such epidemic, which involves many complex factors, such as healthy, economic, and diplomacy. Rationally speaking, the recently targeted adjustment of our prevention and control policy is definitely not simple relaxing or giving up. It is actively optimization rather than a passive steering. Each of them is a measure taken to evaluate the characteristics of the virus strains and the epidemic characteristics and dynamic of the epidemic situation, and actually the acceptance and implementation ability of all sectors of the society. Secondly, I think the regulation and the control have the specific scientific basis, and the basis is mainly based on 2 aspects. One hand, the achievement of our epidemic prevention work in the past 3 years, like the variant of the virus strains, like the vaccine of the large people, like the control plan and the diagnosis and treat plan, its promotion more effective and more certainty. We have developed effective diagnosis of treatment technology and drugs. So we have the opportunity to make such change. I think it's my opinion. It's not giving up. It's just rationally adjustments.
Mm-hmm. And some may feel this is a sudden change, but actually it's not sudden at all, because like you said, we have been optimizing the measures in dealing with COVID-19, in preventing the spreading in the past 3 years. Yunfei also mentioned we have already published 9 editions of epidemic control and preventions. So in the 9 editions, they've been doctors, the experts have been optimizing the ways treating the patients and running the society at the same time based on how the virus mutates. So, and recently, these 2 different versions of measures are also based on the Omicron, how severe it is, and also the requirement of the society. We need to keep the society going and the economy growing as well. So it's not a sudden change. We've been doing this in the past 3 years. But one reason that we're doing this, adopting this optimized measure is, well, many doctors already came out say Omicron is less damaging to our body, less severe. So Dr. Wen, I will pass this question to you again. So is Omicron really less severe than the previous COVID-19 variants?
Okay, very good questions. Let me explain this for you. Let me take my opinion first. Sure, it decreased. And why? And it really happened? Let's see. One of the reasons for the decreased violence comes from the mutation of the virus itself. Toxicity of COVID-19 virus, like another RNA virus, can generate mutation in 3 ways. One, on the one hand, the reason of the decline of the virulency comes from the variation of the virus itself in 3 ways. Like first, like another RNA virus, COVID-19 virus can mutate by replicate errors occurred during virus replication, and the variation caused by chromosome recombination or recombination due to interaction with another virus infecting the same cell. The third, mutation induced by the host RNA modification system is part of the host immune response and has the role of teaching, or someone take it as acclimatization, the virus. It is the third modification mode that makes the virus and the more coexistence, and the violence is weakened. This is the relatively common phenomenon in the nature. Very few viruses remain highly violent and dangerous. Of course, the reduction of violence will increase the ability of the host to transmit a virus. Therefore, in some cases, the violence will decrease while the transmission will increase. This is exactly the current characterized of the new version of our opponent, the Omicron virus strain. As far as the world is concerned, the main strains of Omicron virus include ours. it was reported in South Africa in 2021. Spike protein more than 13 mutations, including those found in other vox. This mutation increased the infectivity of the virus and reduced the sensitivity of the virus to neutralization antibodies, including therapeutic monoclonal antibodies. And the new data show that Omicron variant has replication advantage over the Delta variant, and it can escape from the humoral immunity induced by the infection and vaccine to greater extent compared with the previous variant. The severity of the infection caused by the Omicron variant seems to be much lower than that caused by other variants. In terms of clinical symptoms, statistics shows that the instance of organ damage involved in symptoms such as the smile, the heart, and the lung is much decreased by more than 70%. The overall mortality rate is close to the level of the influenza in previous years. The most typical example, which is one of the best for our new policy adjustment, is that there are more than 160,000 local infections in this round of epidemic in Guangzhou, and 4 severe and critical cases only. And 98% of the total number of positive nucleic acid tests in Shanghai was asymptomatic, and the mortality rate of all patients infected with Omicron virus strains this time was 0. This is far from being compared to the main virus subspecies Delta that prevailed in 2021, and it is objective, rational, and responsible to make corresponding adjustment based on those above conclusions. That's all.
I think I also want to make another point in addition to the mortality rate of the virus. It also, because of the concept we've been talking a lot, which is the herd immunity. Because at the beginning of the pandemic, a lot of people would mention about how can we achieve the end of the pandemic, because this is the virus, we cannot forever make it go away. If we have to coexist with this virus, we have to achieve a certain degree of herd immunity. We talked to a lot of respiratory experts, and they told us that there are simply 2 ways to achieve the herd immunity. Number 1 is that make sure everyone got infected. Everyone got infected, then we achieve herd immunity. Another way to achieve herd immunity is through the injection of the vaccine. So vaccination, if there is a certain degree of vaccination, we can receive herd immunity. Now think about that. At the beginning of the pandemic, we don't have vaccines. So a lot of Western countries would say that, oh, so let's achieve herd immunity and make sure everyone got the virus. But think about that. At the beginning of the pandemic, it was the strain was very, very threatening. So if you have a lot of people got infected, you have to sacrifice a lot of people's lives. Those who are young, those who are old, those who are vulnerable, you have to sacrifice many of those lives, a much higher percentage of life. And I mean, we have been waiting. We have been, hold on to that for 3 years. And at this moment, the mortality rate is much lower. We do, as Dr. Wen mentioned, we do have statistics. Numbers show that we don't have this, Omicron is not threatening as that terrible anymore. So that's why at this moment, China is making a decision to further adjusting this kind of, measures.
You're absolutely right. We are adopting this, based on majority of our people are vaccinated. So we gain this herd immunity in a very less damaging way, because many countries also, other than China, gain herd immunity based on the sacrifices of millions of lives and people suffering from such as long COVID. So this is much safer. I think Yang Yuan, I saw you raise your hand. You want to add something?
Yes, when we're talking about is Omicron really less severe than the previous COVID-19 variants, I can share you some of my experience and my story last year. And I remember that last year, the UAE, the host Expo 2020, and the people from all over the world, they fly to the UAE, fly to Dubai to watch the show, to watch the Expo. And the Omicron started and the spread. And I remember the first spread it in the Japan pavilion, which is very populated pavilion, attract a lot of people and tourists. And then the people, the infected number is increased like 1,000 per day to 2,000 to 3,000. And a lot of people around me, they got infected. And actually, that is really, really hard time for the Dubai. At the same time, we have to keep the important events, keep it open, keep it going. And the other time is have to counter the COVID. And as people around me who were infected, they told me that the symptom is like a more like upper airways, and they got very hurt in the throat, got fever. And I think that is the first Omicron last year, Christmas. And lots of people get infected, and it takes maybe more than 1 week to get recovered. Yeah. And I also think the best way and very effective way to protect yourself is to wearing your mask. We journalists, we have to go outside to get interviewed, to make our story. And I wear mask every day. That's the best way to protect myself away from this Omicron. Yeah, this is my experience from last year. Yeah.
Oh, that's right.
Yeah, I think also because Dr. Wen earlier mentioned something, I think that's very important to stress again, because the recent change of China's measures in preventing the COVID-19 was based on the recent experience, the recent outbreak in Shanghai and in Guangzhou. Because in Guangzhou and Shanghai, we had enough statistics to prove this Omicron, latest variants of Omicron, is less deadly and less damaging, less organs, as let's say, not as the damaging as the first variant. So because based on that experience, we gather enough statistics to prove, okay, it's less deadly, we can do this change. So it's not just came out of nowhere, it's based on the recent experience. So I think we can say the experts, doctors, and governments in China are being very careful, because I think we remember Yunfei, me, and Dr. Wen, we were both in Wuhan when the city was under lockdown in 2020. And we witnessed how hard it was, how difficult, how the situation, how bad it was, because the original COVID-19, the grandfather of Omicron, we call it Alpha, was pretty deadly. And people who got it, even though they survived, they suffered pretty bad symptoms. They were very, very sick for such a long time. And I re-interviewed some patients who recovered a year after they're recovered. They still saw their lungs are less effective than they used to be, like they couldn't run or walk for a long time. So the first one was pretty, I gotta say, pretty bad. So Yunfei, I know you did some amazing reports. We both interviewed many family members who have family members passed away due to the first version of COVID-19. And we went to ICUs to see how bad it was. Can you give our viewers to share some of your experience? What the situation was when, the first version of COVID was?
I think a lot of people have already forgotten before COVID-19, because COVID-19 is a really new word. When the beginning of the outbreak, we don't call it COVID-19. It doesn't have a name at all. So what did we call
Unknown pneumonia.
Unknown pneumonia, exactly. So it's a pneumonia, but nobody talk about pneumonia anymore. If people got infected today, I mean, they talk about fever, they talk about throat hurt, they don't talk about pneumonia anymore. So that's why a lot of experts would suggest that we should change it, give it a different name. So, I mean, because in Chinese, COVID-19, there's also a term pneumonia in COVID-19, 新冠肺炎. So it's still in there, but it's not a pneumonia anymore. So it's not many people will get that severe. Another perspective is that I remember I talked to an ICU doctor. So because doctors are really, rational. They don't get emotional. A lot of doctors would say. So I asked them, so how severe is this disease back in 2020? How severe was that? Can you describe it? And doctors would not say that this is terribly bad. I mean, doctors would not say that. Doctors would be really rational. They say it's complicated. What does it mean it's complicated? I remember one ICU doctor told me is that it's complicated. Why is complicated? Because typically, if you give them medicine, in theory, they will be recovered. Or if I take a certain degree of methods, and it would achieve a certain degree of achievements, but this virus is a little complicated. You have to make double efforts, third efforts, and fourth efforts. So that will really change, challenge the, the medical system, because that will occupy a huge amount of medical system. Back then in the epicenter of Wuhan. That's why they say that we can't endure this anymore. That's why we need to lock down the city. When the city was under lockdown in January 23rd, back in 2020, I was in Wuhan. Myself, I didn't realize that it would last for that long, because even me as a reporter, been to many different places, I don't even realize that this is that severe. I think, oh, it's the Chinese Lunar New Year, so they're going to lock down the city, and then after the New Year, they will open up anyway. But this is something that goes way beyond people's expectation. So I think that's why a lot of people say that the lockdown of Wuhan is a big sacrifice for the people in Wuhan, but it really gave time for the people from the entire world. It really saved the world from a fewer number of people got infected. On the other hand, for those people in Wuhan, there are a huge number of protection. A lot of us were there. None of us were Wuhan people, but a lot of us were there. A lot of doctors were there. China is taking advantage of its system to making it all the way best, give all the way best resources to the epicenter. So everybody is taken care of in this sake.
I remember you when you mentioned you interviewed this ICU doctor. I remember one ICU doctor told me, because he had the same problem with the name of the virus back then, just like you mentioned. It wasn't just a pneumonia, because when he examined enough patients, he discovered the virus wasn't just in the lungs or throat or nose of the patients. It was in the kidney, in the heart, everywhere. And the virus was, the first version of COVID-19 was actually attacking the heart, the lungs, the kidney, the immune system in a very quick way. So that's why many people, not just old people back then in Wuhan, many young people, middle-aged, healthy people also passed away within a few days because it was that deadly, the virus. But so I think the measures, the lockdown or the strict measures was really necessary, because it saved the medical system in Wuhan. It also saved the rest of China, saved billions of people in China to be infected back then. But then the virus mutated, and we see Delta and Omicron. So Dr. Ma, I wonder, can you tell viewers how different, what are the different variants? Because the first one, as we just mentioned, it was very deadly. It was attacking people in different organs, attacking the immune system. But I think reading from the data from different countries, I think the first version and also Delta also caused long COVID or more post-COVID symptoms. And now the Omicron is not causing that. What's your thought on this?
Okay, I think the statistics currently shows that the Omicron virus is much different compare either the Delta variants or the Alpha variants. So it exhibit in many ways, like the severity of the patients, like the involved organ during the disease, like the pre-diagnosis of the infected ones. It's much different. Like I've mentioned before, in this round epidemic in Guangzhou and Shanghai, there is much less, even very small number of critical patients, or none of died ones because of this disease. It's much different compared we saw. As I remember, because I was the patient in the ICU, I participate in the construction of the first ICU constructed by the nation's medical group, and I would see in the first round, much patients of mine didn't get the end. So it's a memory I even don't want to recall, but sure, it can't be forgot. So I agree with all of you. We must know the virus is much less severity, the violence, maybe it's got more ability to transmit. We must see that, but all we must don't forget that the virus comes from, maybe we first found the epidemic in Wuhan. Maybe it's not come from that, but it show very disaster, like a disaster in that and that place, that duration we must not forget.
Yes. So is that safe to say, or correct me if I'm wrong, that the latest Omicron is likely to cause death and the post-COVID symptoms, but the previous variants are, like the Alpha was deadly, and Delta is more likely to cause long COVID? Because I think we've heard the theory of long COVID from other countries for a pretty long time, but that was caused the previous variants.
Okay, you mentioned two words, and first one is the symptoms. It's the severity of this disease. I must say, as far as I've seen in the paper, in the clinic working, the Omicron shows it causes much less symptoms than the COVID-19 variant. The how to say that pre-version, like Delta or like Alpha. We, like I was seeing in the Wuhan, you just mentioned, patients with this disease will show much symptoms and problems. Even our doctor didn't pre-see, like the kidney failure, like the heart failure. But this time, just Omicron shows in Shanghai and Guangzhou. We rarely see that symptoms in our patients. That's the outcome of all in 4 critical patients in Guangzhou and much less one in Shanghai.
And so I think it's well, Yunfei and Yangyuan, if you want to jump in, or if you want to add something, because I think from what we just discussed, I think it's safe to say that in the past 3 years, even though we took stricter rules, even though we didn't go around too much. But these 3 years of epidemic control and prevention measures really gave us the time to wait until the virus got weaker and weaker and weaker. And during this time, we give doctors and experts the time to develop vaccines and vaccinate most of the people. So this 3 years wasn't in vain. The 3 years was giving us time, giving experts and doctors time, and also give the virus time to get weaker. So I think the 3 years was very crucial and efficient.
I think it's also a lot of time. I mean, the Chinese government is experimenting. They're taking many measures, experimenting. They're not saying that, oh, we're going to open up the second day, let's do it. The entire process, they have been experimenting in many different cases in many of the cities. Sometimes they're trying to loosen to some of the measures in several cities, maybe smaller cities. And one biggest example I just came up with was actually the Winter Olympics. Think about the closed loop management system. I was at the Winter Olympics. I think that's a brilliant event hosted by China, because for athletes, nobody wants the Olympics would like to cancel. Nobody wants it canceled. So China is really making a very smart way of hosting the event. They're making a closed loop system. So for international travelers, you come to China, you go through the specific period of time, you submit your testing results, and you don't need to go through the quarantine measures. That's a kind of the way of experiment. And I was reporting the closed loop system. I did a story about finding the loophole, which is really funny. It was really difficult to find a loophole. So once I enter the loop, it's basically completely separated. So they're making a community. They're making a community and say, oh, what if we change the situation like this? What would be the pandemic situation within this community? If something happened, what can we do? So I think the local Chinese government is absolutely learned a lot from the Winter Olympics itself, and many different perspectives, many different events.
Yeah, I remember you were in the closed loop, but I was at the opening ceremony. So at the opening ceremony at the stadium, actually people outside of closed loop and inside of closed room, we were both in the stadium watching the opening ceremony. But I was also amazed by the measures, because we were from two circles, but we wouldn't cross to each other, bump into each other at all. So they designed completely two different routes and spaces to make sure all of you can watch the ceremony, do your work, do your filming, reporting, while not crossing into each other at all. So, and it was a huge venue. So I was surprised, how did someone do it? So I gotta say, I give a lot of credits to the measures taken by staff from all levels, either the government or the organizers or from the community. They really sacrificed a lot in protecting our lives. And also I saw these comments from a lot of citizens in China when they posted online, said because we are adopting these new measures, they are sending their gratitude to all the medics, all the community staffs for their contributions, for their dedications in the past 3 years. So all of us can be brave enough to go out and to face this much less severe Omicron. So this is mood. Yeah, Yang Yuan, yes, continue. I was about to ask you your thought.
I have another point. I don't really want to compare which government did better, which government, and I think our country, China's, our policies, it's really protect a huge number of people, especially the elderly people, the young people. Yeah, because different countries, they have different situations. Yeah, and like in the UAE, the people's much less than Chinese population. Yes, and I think our country did very well in the past 3 years. Yeah. That's my point of view. Yeah.
Indeed. Of course, these measures adopted in China probably cannot be duplicated in the rest of the world because every country has different culture, different systems, and different ways of dealing with things. So, I think from what we've experienced from the 2020 to now, it indeed saved a lot of lives because right now we have the world has millions of people passed away because of COVID, but China, even 3 years, we still have around 5,000 deaths. And so this is important. And also, I think, don't forget that a lot of experience that China's doctors and experts have been sharing with other countries and rest of the world. In terms of, I think many of you, if you watch the news, you probably already saw that China sent medical teams to different countries like Cuba, Serbia, also sent medical supplies to countries since later 2020, when China recovered from its own outbreaks. It immediately sent teams and medical supplies to the rest of the world who later had outbreaks. So Yunfei, I know you've been doing some of this work as well. You hosted some meetings featuring doctors from China and rest of the world as well. So can you share with our viewers some of the amazing work done by China's doctors?
Well, there are two major, I would say there are two different things that I ever did as a reporter. I mean, in addition to regular reporting in Wuhan, another two different things I did is that I hosted a panel called something like a chat room like this, but joining the doctors in China who have been working in the ICU or other respiratory courts, and with doctors from internationally, because Wuhan, the doctors in Wuhan, they have experienced it, so they have something to say. They have something to, share the experience. I mean, I think that's the good, attitude of the doctors who are fighting in Wuhan, because once they gain the experience, once they got the opportunity, they got extra time, they go to our CGTN's chat room and share with international colleagues, and they tell them what really happened. I think that's really because they are taking advantage of their time of taking rest, because given the pandemic, it's better if you don't work, you better take a rest to boost your body condition. But a lot of the doctors would take those advantage of resting time to helping others. Another thing I ever did is that I also did live shots for international media outlets, because they are curious to learn about, specifically what are the current measures that Wuhan is taking to curb the spread of the virus. And I mean, many, I have a little observation, because once one continent is being, badly hurt, the media outlets from that continent will actually go to us and saying that, hey, can you do a live shot? So you can actually see a certain number of the media outlets coming to us as this virus going to turn out to be a global pandemic. I think all of those things is that the transparency. It comes to the transparency of how the government is trying to share what really happened over there in order to help the entire global community.
Mm-hmm. And also, Yang Yuan, I hope you can add something, because China and Arab states have a lot of cooperations, not just during this recent China-Arab State Summit, not just recently signed cooperations. This cooperation started a long time ago. So, and also China, I think, sent some medical teams and supplies to several Arab states. Can you share with us some of that?
Yes, I think China and the Chinese scientists are very willingly to share their experiences with the world in the first time at the early stage of the pandemic. Since the 2020 March, some Chinese medical experts, they're fighting alongside the Middle East countries, and China sharing experience and their donations, medicine donations, supplies to these Middle East countries. I think these medical supplies have been boosting the confidence and capability for the regions in fighting against pandemic, which is very important in the early stage. And besides this, and China has helping with a lot of Middle East countries like Iraq, Iran, building the test lab, and the Chinese medical team always they also brought medical like screening equipment such as like mobile X-ray and the CTs, which are very important equipment. And they also train health workers and share clinic guidelines and experiences with for local people and teach them how to prevent and control the infections. And in UAE is the first Middle East countries to produce the China's COVID vaccine. Yeah, and I think which is very important. Yeah, and the Chinese vaccines, I think, play a very important role in fighting against the COVID-19. Yeah.
Mm-hmm. So.
And,
yeah, you want to?
Yeah, and I think the Middle East countries they never forget what China has done for them. Even the China, not only the China's government and also Chinese scientists. Just 4 days ago, I went to a award ceremony which was held in Dubai. This is called Al Maktoum Knowledge Award, which is like very high ranking. And the Chinese scientist, his name is Zhang Yongzhen, was granted for this award. And I know about what he has done in the early stage. He's like groups, because at the early stage, a lot of China scientists they screen the RNA or DNA of this virus, and Zhang Yongzhen, he's like the first person to public in the world, and which saved a lot of time for the whole world, the research people to study, to research the virus, and save time for the research for the vaccine. Yeah, that is why they granted this important award to him. Yeah.
Yeah, you mentioned something very important, because I think besides sending medics and medical supplies, China's doctors also did something else that helps doctors from other countries to save their people. I think first is, we've mentioned earlier in the show that actually China's expert published updated 9 different versions of epidemic control and preventions. In these control and preventions, it's being listed pretty specifically what kind of effect this virus would cause, some specific cases of patients, how to treat them, what medicine are effective. And they have been translating the preventions and this preventions into different languages, not just English, different versions, different languages. And they've been sharing that since as early as we were in Wuhan. I remember doctors were holding conferences, sharing this prevention control, sharing China's doctors' experiences in treating patients in different languages. So doctors from rest of the world can save their patients. And I even talked to some doctors in Spain, because it was the first time they've been dealing with such a virus. They don't know how to disinfect the region and what kind of medicine is effective to save the patients. So even I didn't do any report on this, but I was the communicating bridge for these 2 doctors, because I was asking the experiences from China's doctor and pass this knowledge to them. So China's doctor has been sharing that. And also, like Yang Yuan just mentioned, China's doctors also was the earliest to share the sequence of the virus. So doctors, experts from other countries can analyze the virus and develop their own vaccines. So these are something very important for the whole world can recover from this pandemic, but probably not being realized and talked about by a lot of people. So yeah, I think that's something we shouldn't forget. What's your thought, Yunfei?
I think the reason why international experts would like to learn about China's COVID prevention and control policy is because it's consistent. It's consistency. It's a very consistent policy. And the entire process of how China is doing is completely respecting the rules, respecting the science. the entire process of prevention, of control, and control of the epidemic, it's not driven by politics. It's absolutely a way of driven by the scientific research, statistics, and many experiments, different perspectives. I think I also want to mention about the Western narratives, because a lot of Western media recently would say that China opened up or changed the methods based on because of people complain about it. I think that's absolutely nonsense. China certainly listened to what people are saying because it opens platforms for people to submit. If the local government don't follow the rules, there is a way. There's a way you can file the complaints. But at the same time, I think a lot of the narratives of the Western media outlets is that they're using the zero COVID policy saying, zero COVID policy, I don't think that's a good translation of China's method, because 动态清零 is not just necessarily zero COVID policy. It's dynamic zero COVID policy. So, because people have already realized that we will have to coexist with this kind of virus. So it's absolutely not a zero COVID, an absolute zero COVID policy. It's a dynamic policy. Mm-hmm. Why we do that? Because we need to minimize the rate of people who got infected when the mutation is still threatening to the entire world. But at this moment, research shows that it's no longer threatening anymore. So at this moment, it's a perfect time for not threatening the vulnerables. And that's why they're trying to change this kind of policy. That's why China doesn't say that we're losing the policy. It's not losing the policy. It's still targeting precision prevention and control. It's just a very smart transition and adjustment.
Mm-hmm. Yes, we are changing the policy based on the change of the virus itself. And also, well, since you mentioned the Western narrative, remember when the outbreak first broke out in Wuhan, at first they criticized why you put a lockdown on the city. And later when the virus spread to their country, they started, why you didn't put a lockdown earlier? You're spreading this to us. And since we literally had no cases at all in later 2020 and actually the first 2021 as well. I mean, and they also said, why you recovered and we are suffering from this. So it's just no matter what you do, they will always find a way to criticize you. But we know that no matter how much they criticize us, actually millions of people are saved. And especially China has the largest population, 1.4 billion people. No country in the world has such a population. If we let the virus let it rip like the rest of the world did, the damage is unimaginable. So we cannot afford to do that. And I think we had discussed enough, but I want to give the last question to Dr. Wen, because now since we are changing the policy, we are changing the measures, some may worry because I think now the Omicron still affect people, individuals differently. Some people got severe symptoms. Some people probably had no symptoms at all. So what should people, the general public, prepare since now we are changing the measures and many people probably will get the not deadly Omicron? So what should they do? Should they worry? Should they be concerned?
Okay, as far as I am concerned, some thinking you just mentioned, I think some part of it is not right. I have many advice for my friends like all of you. There is a saying that I'm very agree with. The epidemic prevention has just ended, and the fight against the epidemic has just begun. And I look forward you to work together to do following things, like such as masks, vaccine, timely detection of symptoms, and timely treatments when you found yourself infected. and isolation while infection. In the face of the infection situation that most people face with in the future, the above points can be achieved in order to achieve late infection or even no infection. It's very important, either you or people around you. Why I say that? Even if it's easy to be infected and it is particularly important to reduce complications and reduce self-centered transmission to another one. In particular, we all have elderly, the children, the patients with chronic disease like liver, heart, and another COVID-19 groups with several risk factors around. Those people are very precious for us. Even if you have no symptoms, you are safe, but the infectivity is inevitable. You can make them get infected, and they are very dangerous. In order to prevent people who are so important to us from suffering or facing danger, we must try our best to be responsible for ourselves and others. And I must let you notice that the severity and the mortality of this disease is much more times in the elderly compared with young people age under 30. How much? 100 times when people aging comes to 85 years old. So it's very dangerous to them. So I ask everyone, just hearing what I just say, do what I just mentioned. And I believe that in the nearly future, perhaps next quarter, we can safely overcome the current twists and turns and achieve great victory over the epidemic.
Okay, thank you. So I think this is just suggestions to us all is if you're young, healthy, you probably don't need to worry too much about this Omicron since it's much weaker. You probably will have fever and coughing symptoms, but it's probably different based on different individuals. But if your symptoms is not too severe, don't panic. Have enough nutrition, drink enough water, take some medicine, you will be cured with no post symptoms after this. And I don't need to flood the hospital because we need to give enough medical resources to the people who really need it, like people who probably don't have COVID, but they probably have cancer, but they probably need to do dialysis. So we need to give the limited medical resources to the elderly. And also if you have elderly in your houses who have underlying issues, you probably need to be more concerned, more worried than the rest of us, because it's probably more dangerous to those group of people. So always protect yourself with the masks, with enough washing your hands and disinfections. So and we don't need to panic and to be concerned too much, paranoid, no. But and hopefully we will all get over this very soon and embrace a new future. Okay,
Sure.
so thank you so much, everyone, for sharing your stories, experiences, and your analysis. I think we are all being very optimistic about this new change, and hope we will all get better in a much quicker time. Okay, thank you so much for your participation.
Thank you,
Thank you for hearing.
Thank you. And to those of you who are watching this chat room, stay tuned with the chat room on CGTN, because we will always bring the guests from around the world to discuss the latest issues. So see you the next time. See you in the next episode of the chat room. Bye-bye.
Okay, see you.
See you.